Hello, everyone. My name is Marissa Weiss, and I'm from the lymphology marketing team here at JOBST. Thank you so much for joining us today for our webinar series. So today we're going to be speaking about advanced JoViPak measuring options as well. We hope you'll find it interesting and very informative. But please note that this is a recorded session, so we will not be taking questions at the end. However, you can direct any to me, Marissa Weiss, and I will help get them answered. This session is about 50 minutes. And for future webinars, which we will start doing monthly now, please join our email listserv if you have not already done so, and that'll provide you information on webinars going forward as far as new products and promotions that we're doing. So again, thank you so much for your time, and I'm going to pass it on to our wonderful host. She's an OT and a CLT, and she'll tell you more about herself. Carol Johnson, take it away.
Hello, everyone. Thank you, Marissa. I appreciate that. My name is Carol Johnson, and I am an occupational therapist and a certified lymphedema therapist, LAM certified. I have been working in this world and working with great passion, and I love to design and I love to measure for garments for that clinical person who needs compression. Burns, vascular, orthopedic injuries, and of course, lymphedema management have been the focus of my 40-year career. Eeks! Thank you for joining me as we explore the JOBST JoViPak Advanced Custom Garments, and now you can comfortably obtain these for your patients. This session is basically on how to understanding how to access product information, the website navigation, which will be quite brief, understanding how to access options and measuring forms, the importance of the materials, which will also be quite brief, how to submit extras, additional notes, additional measurements, photos, and specialty custom products. Some of the presentation is included simply to provide you with an extensive reference for better understanding and how to access that information. And you need to secure that for those specialty products. Therefore, some of the slides included will not be fully discussed, as there are basic knowledge about JOBST JoViPak products that you should probably already know. If not, this will be a good reference for you. If you find yourself not fully understanding, please know that this presentation will be available at JOBST Compression Institute, or many know it as JCI, for your viewing at any time once it is posted. Basically, I just want you to know, in terms of the JoViPak website navigation, how to access the product and how to get order forms. Once you go to JoViPak.com, please look for products, and it is designated here with the red arrow. Progress through the products list, and it is divided between upper body and lower body. Click on which garment you are wanting to choose. Then you can choose your order form. And this is what I want to concentrate on today, or at this very moment. In this case specifically, I'm going to use the arm sleeve order form as an example for all forms. This first red box is our information box, and you will see this on all forms. And this must be completed in full. Otherwise, we have incomplete information. We certainly need to know what the payment information is. And we need to know how to process your order. We need to know how to bill for the order. We need to know whether you are asking for a quote only or a quote and proceed, which means that we will proceed with your order but send you the quote. Or do you just simply need reseller or retail information? Just let us know. If you need a rush order, it is available, but we can't always guarantee it. Be careful if you ask for a rush order, and be careful that you take your measurements completely and correctly. Yes, we can offer a remake if you make a mistake, but it will add an additional 4 to 6 weeks to that order in most cases. We need to know how you want that order shipped. Please indicate that in one of the boxes. Once that is completed, and this will again be on every one of your order forms, fill it out completely. Then you will go to the garment options, and that will be at the bottom of every page. Choose your garment from the listing on the bottom, or the pictures, the drawings on the bottom, and then choose the garment style, the materials, and the color and the foam for your patient's garment. If you're uncertain, please ask for a medical advisor to help you, and we will show you your medical advisor at the end of this presentation. Or you can also call the inside sales representatives, either Kathleen Lutman for the western half of the US, or Anastasia Stebakova on the eastern half of the US. Please include your fitter or your therapist name and the phone number at the bottom of this form. Should we have questions, we can quickly call you so as to keep that order on track. Remember, every time we have to call, it slows down the order process, especially if you can't get back to us within just a few days. So let's go on now to the order, the measuring form itself. Tell us if we have tell us if what your patient's name is. Tell us their height. Tell us their name. These, their height and weight. If you give us their name, which you really need to, we also include that on the label on their garment. So please make sure that that is present. Tell us if we made a garment for your patient in the past. Tell us if we're making a garment for a primary or a second lymphedema. This is imperative because it indicates which way the continuous flow channels will be drafted for the pattern of the garment of which we are making. Now, let's go on to the measuring. Be sure to give us all circumferences and length measurements. Measure it twice. Add additional measurements if you think it will give a better picture for that garment. On the right side of the forms, you have garment styles and options to choose from. Be sure to order Jovi jackets and Dyson pads to complete the order. If you order a garment that includes a hand or a foot, be sure to include your tracings with your order. It is imperative that we get a total hand or foot length on these garments, even if the garment does not cover the entire hand or the entire foot. Our pattern formularies are dependent on these lengths. Let's go on now to some general guidelines. These will help with many conditions and circumstances that you will encounter in measuring for custom garments. The general guidelines include certainly the landmarks, which are industry standard. Measuring forms are available online according to the product selected. Go to JoViPak.com. Customer service representatives are available to help you at 866-888-5684. And if you prefer to use email, you can send that to info@JoViPak.com. This is an important email for you to remember if you're going to send us pictures. Consider wrapping soft, flabby, or pendulous skin with plastic wrap, ISOBAND, or a mildly compressive garment to help lift and approximate loose tissue to its quote-unquote normal position before taking measurements. It may be best to accomplish this with the patient in supine. Consider having your patient in supine for circumferential measurements in almost all cases, as this is likely the position that they're going to be in when they're wearing that garment. Again, take your time. All length measurements are to be taken medially for all garment lengths. Consider having your patient in a standing position for legs or lower extremities, or sitting and standing, or a standing position for arms or chest. Consider using a 1 or 2 finger width from the actual proximal length and subtract that from the desired length of the garment so that the garment is not too long. If the garment ends up being too long on an arm especially, it will cause the garment to come off. All circumferences should be taken with the measuring tape securely on the skin. No skin popovers. Additional circumferential measurements can be added to the form when needed. So again, length should be taken from distal to proximal for the lower leg and for the arms. Consider using the JOBST measuring board. This is really a handy tool if you have it. Circumferences should be measured with the patient in supine if possible. Pull the tape measure up snugly against the skin, but do not allow the skin to pop over the tape. Let's talk about some of these special considerations for our patients. Sometimes we encounter lobules, of course, and they need to be lifted and contained. If we have a problem with incontinence, then we want to use less is best as a general rule. Order that garment with a shorter medial length for a leg, and make that G length a little bit shorter to keep the garment out of the groin or out of the crotch for sanitary considerations. And note that reason on the form so we understand why that's a short length. If you have a patient with an amputated leg, measure it from the floor to the distal level of the leg, of the remaining leg. Note that length on the form. Take all other measurements as though the amputated leg was in place. Request closed end if you need that, and in most cases for an amputation, we do close the end. And certainly submit pictures at info@jovipak.com. Scrotal edema is a condition that is encountered by many therapists or fitters. Consider using a genital pad and or a boxer. For men, measure the circumference of the scrotum and choose the appropriate size for a ready-made. It can also be made as a custom. For women, order it by pant side or hip circumference, and again, that can also be custom made. If you choose the pad, make sure that you are considering what external compression garment you need to cinch that garment into the tissue. And of course, the boxer is available as a custom only. If the patient has lipedema or lipedema, consider requesting darts to lift the overhanging tissue at the ankle. Zippers can be considered only if the patient has hip mobility and strength to do so. If the hip mobility and strength has a discrepancy to approximate a zipper, then that is not a good option. Customer service or your medical advisors can help you make that decision as to how to proceed. Sometimes we come across the flaccid limb, and in those cases, usually a zipper is going to be recommended, and we often will use a two blend foam for that and cotton, lycra, or silk weight fabric. Anytime you have an open wound, consider using an ADVI or an ADVI combi. We recommend that the wound be near closed, but it can be worn over a wound dressing. Having two garments allows for a wash and wear continuity. If you have a patient with an abdominal panas, if it is extreme, consider the boxer with the panas modification, and we will discuss this in length as we proceed with this presentation. You can also order a custom abdominal pad to treat the underside of a panas and to separate that skin-on-skin contact. But always think about ordering two for a wash and wear rotation. Certainly call customer service for assistance. Drooling is something that we often see for patients who have had head and neck cancer surgeries. We advise using an absorbative bandage under the head and neck garment. Order 2 head and neck garments to rotate in the wash. All children receive a 25% discount on garments for children under the age of 16. All right, now let's talk about measuring lobules or excess tissue. Make sure that you are going to bind that excess tissue before you measure it. We can use plastic wrap or a light layer of bandage. Approximate the tissue toward its normal position, and it needs to just gently be lifted. Be mindful for the abdomen not to lift it beyond the abdominal, the weight of that the abdomen can take, as it can interfere with normal breathing. These garments can only support a certain amount, and it would be your judgment to determine whether that amount will be supported by the garment that you're ordering. Let's go back to the amputation. Use the leg measuring form and place a line at the level of the amputation. Take all length measurements from the floor. Mark it out if you need to. And just give us a note about the patient's condition. Is the end of that stump completely closed? Have they been wearing a prosthesis in the past? Give us what information you can that you think will help give us a better picture of what we're making for your patient. So for example, you would put in this comments area, left, BKA, close the end. Okay, now if we have a patient that has lipedema or lipedema, let's measure that foot circumference and length as usual. Consider using the JOBST measuring board. If possible, lift and gently bind the apron with a plastic wrap or a stocking. Then measure as usual. There's no need to measure under that apron. It is, however, helpful to measure the distance from the floor to the distal edge of that apron and indicate it on the measuring form, even just a firm, straight across line on the ordering form indicating bottom of apron. Now we also have to talk about the abdominal panus, and we are going to be talking about this off and on through the rest of this presentation. Prior to measuring for a boxer or a boxer with a panus, and with the patient in the supine position, gently lift that excess tissue toward a normal position. Use plastic wrap to secure. Too much lift will interfere with the patient's ability to breathe normally. If the patient exceeds 350 pounds, please send us pictures. We often do not guarantee garments beyond that weight. The boxer may not be able to support the abdominal panus. If in supine the panus does not disappear, it may require a special modification using the boxer panus form, which is to follow. The materials we're going to talk about here, I will talk about them very briefly. Polartec Power Dry is our most containing material. It has the least amount of stretch. It is made of 100% polyester. The Silk Weight is another Polartec product, and it is a little bit lighter in weight, has just a little bit more stretch, and is ideally used for patients who have fragile skin, for patients who might be deconditioned, or if you think that they would be better off with a lighter weight product. The 100% organic cotton lycra is a jersey knit fabric, and it is grown and milled here in the United States. It's a very soft fabric, and it's very stretchy. This fabric, however, does not have a wicking property such as the Polartec fabrics. but this one will also show a little bit more wear and tear earlier than the JoViPak fabrics made of polyester. Another material that goes into these products, of course, is the foam, and it is called indention load deflection foam, or ILD foam. We make it in a 2 blend and a 4 blend. The 2 blend is the softest of the 2 blends we offer. Now, it's really important, beyond the materials, you're getting ready to start thinking about what garment you're going to use, and now you might have lots of questions. So it's really important that you know how to take photographs so that they are the most effective for us to be able to engineer a garment for you. Pictures need to reflect the entire limb that the garment is being made for. We don't want a close-up of a back of a knee, for example. That doesn't help us understand the size of that garment, the length or the width. Take these pictures from the waist to the neck without faces, or from the waist to the foot. Choose a plain background that is without distractions, like a wall without pictures. And stand away from the patient and point a camera. Your iPhones work perfectly, or any other phone that you might have in your possession. They are wonderful to take these pictures, but take them at a 90-degree angle to the body part. So if you need to, kneel down and shoot straight at the limb. Do not take a picture from the top toward the bottom or shoot up at it either. Stand straight and even to it and get a 90-degree angle to that body part. In addition to these guidelines, make sure that you give us three pictures of that limb or that body part that the garment is being made for. We need an anterior view, a lateral view, and a posterior view. This certainly gives us a good 3D understanding of that tissue. Send those pictures to info@jovipak.com. Let's move on to the actual products that we can offer as an advanced product for some of your patients. Certainly an arm sleeve is one of the more common garments that we make for patients, but we also make that arm sleeve with a glove attachment. If you want a glove attachment, if the patient's hand and fingers are swollen, you probably do want a glove attachment. That is a convenient nighttime compression as a single garment. And in this case, you can see that we have modified one of these. There's a pad in the palm. There's a zipper completely along the lateral aspect of the garment. And in most cases, we don't put zippers in, but in this case, we needed to. So you can see that these can be highly modified. You can also order a sleeve with a separate glove or a gauntlet. These are convenient nighttime garments if a glove needs to be separated from the main sleeve. A combi sleeve is a daytime sleeve for difficult fibrosis. This has about 30 to 35 millimeters of compression. So it is a high compression garment and should only be used during the day. These I use in my own practice with a regular daytime knit arm sleeve, and I use it in rotation. So for instance, I might use this for 3 days a week and have them wear their regular knit arm sleeve 4 days a week, or part of the day in rotation. An Ena sleeve is another day and night arm sleeve when donning and doffing is problematic with other products, or when the patient caregiver struggles with the traditional product. This is also a good option for palliative care. Don't forget that you can add zippers, pads, donning pads, Jovi jackets. Call us. Call your representative if you have an idea. Let us know, and we can discuss it. The arm sleeve with the glove attachment is a very popular garment that we make pretty readily. Certainly, we want you to fill out all of the first information about your patient that we're making the garment for. And then from there, we need to know what style you're going to be ordering, what length of garment you need. So place an X or a check in one of these boxes so we know what length that you're thinking of. And certainly give us the color of the fabric you've chosen. Certainly choose your fabric. And then also make sure you give us what which JoViPak material you are choosing. From here, then you are going to go to your measuring form. You're going to include all of your circumferences and all of your arm lengths. Be sure they are completed in full. Now your arm length is going to be from C, or the least wrist, to G, which is at the axilla. I always like to give a 1 or 2 finger width reduction in that length so that it's not too long. Then be sure, if you're going to have a glove or a gauntlet attached, that you completely fill out the requirement of the boxes that are on the hand. It must include the total hand measurement from C to A. It's imperative that we have this. This is important because our formulary for making that garment is dependent on that length. And then give us a curved line across the tips of the fingers so we understand where you about want that glove to end. If you have a patient that has heavy swelling clear the tips of their fingers, you might want to draw that curved line right to the end of the fingertips. If not, maybe you want it back to the nail bed or even lower. So give us a gentle curved line so we know how to end that glove. Then from there, make sure you indicate what style you're ordering. Is it a regular arm sleeve? Is it a combi arm sleeve? Is it an ENA sleeve? Are we making a glove for it? And so on. You have no charge options and additional charge options. Be sure that you order your JoViPak and a Dyson pad so that your patient can have optimal therapeutic benefits and ease in donning these garments. The vest is the most commonly ordered in cotton lycra fabric, and the JoViPak locks that compression into the chest wall. There are multiple options available for channeling and certainly for placement of that foam. You can order it in 4-blend foam or 2-blend foam, of course. Every area that does not have cotton lycra with foam in it will be filled with a double layer of cotton lycra. That's where the foam is not needed. Let's talk about the vest order form here for a minute. This order form, of course, needs to be completed in its entirety, as we've talked about before. And basically, you need to choose either the cotton lycra is what we usually, or cotton in the spandex, which is the fabric for the JoViPak, is about all you need to choose. You could call and ask if we need to, or you could make that in a Polartec Power Dry fabric. They have been made in that before, so you can call and see if that's something we can do for you. This garment has been reported to be sort of a concern for people to order because they fear that it's too complicated. So let's walk through the ordering process. It's really not too complicated as long as you understand the landmarks. Simply take your time. Give us the circumference and the length measurements as you see here, left and right side of the drawing. Let me explain on the circumference, the H to G to H measurement, which is the circumference of the armhole. So basically you start at the level of the axilla and come up around the front of the arm, tip of the shoulder, and back around. And that will be your circumference measurement. Now for your length measurement, another very important one is the K to R measurement. And this measurement is the one from the natural waistline to the base of the armpit or in the armpit. We do not need a full measurement over the top of the shoulder. Now you also have options for using a slim line, which means that we usually use a 2-blend foam, or we use a 4-blend foam, depending on whichever one you want. We can offer you a crotch strap if the garment doesn't stay down. You'll notice that there's a peplum on the end or at the bottom of this garment, and that helps give more surface area to keep the garment from going up toward the neck. In choosing the channeling for this, we usually will use a unilateral mastectomy channeling with the channeling going horizontal and only on half of the body. Again, the other half that doesn't need channeling nor foam would be double layer cotton lycra. If you need a garment for a unilateral swelling in a bilateral mastectomy or a lumpectomy patient, we certainly can make that a vertical channeling on half the body. Use the bilateral mastectomy channeling pattern for patients who have bilateral mastectomy or lumpectomy. When those lymph nodes have been removed and or radiated, that lymph needs to drain toward the inguinal lymph nodes. Therefore, we have vertical channeling. All right, now we can go on to the shoulder torso extension sleeve. And again, this is a sleeve that has many faces. It can be ordered as a single arm or a bilateral arm. The chest wall padding can be ordered to cover the entire chest, half the chest wall, or with no padding at all. It can be ordered with a detachable glove, with a glove attached, or with no hand portion, and certainly can be made as a gauntlet or as a glove. Now we're going to go on and we're going to talk about the measuring form for this. Many people think this looks somewhat daunting, but let's just take it in sections. You can see that it's really not that complicated. This garment requires measurements for the arm. We certainly need all the lengths and the circumferences that you see here. And then we need the same for the body. We need circumferences and we need lengths. And that length is from the lowest rib to the bottom of the axilla or into the armpit. It's just the same as the vest. Then we also need another one certainly if you're going to make this to the waist, then we would need a measurement from the waist to the bottom of the axilla as well. And that would be indicated and recorded down here in the bottom of the form that is circled in red. Then we need these length measurements from the shoulder to the lowest rib or to the waistline, and that's from the acromion process to the bottom of the rib or to the waist, and recorded in the bottom square that you see here in the blue. We again need a circumferential measurement around the armhole from the acromion process under the armpit, and back around to the acromion process. And that is recorded there under circumference as the H to G to H, which we've discussed previously. Another very important measurement is this measurement from SS to H. And basically this tells us how wide you want the top of the shoulder strap to be. Do you want it to stop right at the edge of the neck, or do you want it to set out toward the acromion process just a little bit? So measure from the acromion process along the top of the shoulder and tell us how wide you want that to be. And that will be your measurement there for SS to H. Now, it wasn't that bad, was it? We will proceed now to the legs. The LEAD, or the lower leg AD from toes to knee, is available as a ready-made, certainly. But of course, it's also available as a custom. If your patient doesn't fit into standard sizing, then a custom is the only option that you will have. This is often the garment that is issued in tandem with a hip hugger or a boxer capri for a complete leg solution. You can also add zippers, as we've talked about, donning pulls. You certainly have every length and every width that you need for your patients, and we will offer the channeling that would be appropriate for primary or secondary lymphedema. Make sure that you check that on your forms. The modified comfy boot has been a very specialized adjustable day and night garment for ease in donning. It has a very specialized opening so that it's easy for the patient to actually lower the leg basically into the garment once the foot is in place and then strapped across with multiple tabs. Please call us if you need this type of modification for your garment. On any of the leg garments, we can add an AD-VI foot. AD for toes to knee, VI for venous insufficiency. And the venous insufficiency, the AD-VI, is the garment that you see here on the right, and it is typically made of cotton lycra. And we will be very happy to put this AD-VI foot on a full leg garment. It allows for a patient to wear a shoe, and this tends to be a nice garment for the lymphedema patient. So here are our leg forms. The leg is one of those. It's of course, very, very popular. Make sure you fill out the top part of the order form and give us which length that you need. We recognize that you have many choices here, so consider what is the most appropriate for your patient. Discuss it with them. I'm sure they have, in most cases, an idea of what would be better for them. We have a system and a choice for garments for the entire lower leg, whether it be 1 or 2 garments. Again, be sure that you complete the top portion of the garment order form and give us the length of the garment you want. Give us the type of material and the colors that you're going to choose. Be sure to complete this foot portion completely. And most importantly, the total foot length is required, even if you don't need a garment to go all the way to the end of the toes. Take that measurement from your tracing of your foot if you want to, and then include that in the bottom square of the order form there. Our formulary, again, is based on that total foot length. We offer a no-charge option to cover the toes completely. So if you want that garment to go all the way to the end of the toes, we certainly can do that. And you will see that under the no-charge options on the right side. You also can cover that garment. That garment can also cover to the base of the nails or to the base of the toe. So then you also have the option of putting this ADVI foot on your garment, which we just previously discussed. So that is an additional charge option. Call for a quote. Okay, and make sure that you ask for a JoVi Dyson pad. That's going to be very important. And order your JoVi jackets at the same time. Now, let's talk about measuring for lobules. Lobules on the leg can really be overwhelming for many people. But if you take it in sections, it's again one of those projects that's really not too hard. You want to measure this heavy and soft lower leg tissue very carefully, and you want to consider that that lymph needs to drain into the tissue when it is slightly lifted in the garment. So while the patient is supine, gently lift that tissue, secure it with plastic wrap or a light bandage, and then measure. I'm sorry, I'm going to, my clicker isn't working right for me to show you this. Here we go. The first outline here is, if you will, consider this a garment that is in place. The tissue is slightly lifted in this, as you might see, that because we took a firmer circumference around that area that was soft, and it allows for the garment, the tissue to be slightly lifted in that garment. And so you can see that it will allow for better drainage, lymph drainage, and that is the whole point to these garments, of course. When you're ready to measure for the upper leg lobule, you'll do that next. Now, on the next picture, notice that there is an angle at the top of the garment at the knee. It will always be lower medially and higher on the lateral aspect of the knee. So you can see that there is quite a difference in lengths between the two. These garments are going to fit under any lobules that might be hanging at the knee. Let's talk about a hip hugger. A hip hugger is one of those garments that can be used to help lift one of those lobules, or it can be used for a funnel-shaped thigh. Hip huggers can be worn at the same time, so you could order two, one for the left and one for the right. It's a good solution for toileting concerns. However, it is not appropriate when genital swelling is present or is suspected. Order the lower leg in combination with this for total edema management. So let's now talk about the order form here. First of all, let me explain the K through K, K through G through K. You take your measuring from the middle of the abdomen above the navel at the natural waist. You bring the tape through the crotch and then back to the posterior natural waist to K2. That length measurement then is at the very bottom of this form. All measurements should be taken, all other measurements should be taken from the floor. Be certain to complete the foot measurements for a full leg if you need a full leg, if you need a full foot. Include the total foot length if it's applicable. And in most cases, most people want a foot on their garment. Occasionally, they just want a garment that ends at the ankle. And if that's the case, then the foot portion would not be needed. Be sure to add your no charge options to cover the tip to the tips from the tip of the toes or back. And if you need an additional, if you need a Jovi jacket, certainly you can add a dorsum pad or a pad behind the knee. Zippers certainly can be added, and donning loops. And of course, those are additional charge options. The boxer and the boxer capri. Boxer garments are very popular and are appropriate when thigh, hip, buttocks, and abdominal swelling are present. Use the boxer if genital swelling is present. Now, we're going to talk about these extreme abdominal panuses, as I promised before. Basically, I want you to understand that when the abdominal panus does not disappear when a patient is supine, then we need the order form for the custom boxer and capri for the panus. It's recommended that this garment be constructed with 2 zippers, one on each side of the body or the lateral part of the garment when it's on the body. We need the zippers to be checked over here on the right side of the order form. And then please go on and give us the, I'm sorry. Give us the 2 new measurements that are not on the normal boxer form. The capital PL measurement is going to be shown as a measurement taken from K1, or the natural waist at midline, over the top and under the panus to the deep skin fold, or where it attaches to the body. Then we also need, so that's your length measurement around the panus. Then we need a width measurement, and this is a measurement that is taken in a straight line. Do not use it as a contour on the body or over the top of the panus. Just give us the width. So here's the PL, and here's then, and it's recorded in the box that is circled there in gray. And then give us the PW, which is the width, of course, and record it here at the bottom, as you see the widest width and not curved. Again, we're talking about having a patient in the supine position. If the panus disappears, it's likely that the regular boxer will manage that abdomen. But if that panus is so large that it continues to lie on the thighs when the patient is supine, the order form for the boxer with the panus will be required. And here's a nice picture of how this works. The natural waist from above the navel, over the top of the panus and under that panus to the point where it attaches to the body. And that's your capital PL measurement. Then we need the small PW, or the width, in a straight line across the body. This is a funny quote that one of our medical advisors made, and she is from the Pittsburgh area. Her name is Lorraine DiNatale, and she is a very, very talented therapist and advisors, as are all of our team. But she came up the other day with one of these things, and that was, not all panuses are alike. I had that written incorrectly. Not all panuses are alike, and that's the truth. So if you've been around people who have these large panuses, you will see the humor in some of that, or not, the not humor in it as well. So do pay attention that sometimes panuses have different aspects to them, and we may need to add extra things to it in order to make them, in order for us to be able to make a garment that works correctly. We want to make a garment that meets the patient's condition. And in this condition, the patient has one side that is much, much larger than the other. So instead of just one length measurement for the PW, or for the PL, we need two. We need the long portion and the short portion so that we can make a garment that will meet that patient's needs. So this pannis garment actually has an extra pocket in the front to help support the pannis and separate skin-on-skin contact with the anterior portion of the legs. Sometimes these specialty products are necessary, and it is our hope that at JoViPak that we remain committed and can help you and to provide your patient with an effective garment. We are all about listening to your needs. This is what sets JoViPak apart. If you do your part by measuring carefully, we can get your custom garments to fit the first time. We'll do remakes, but it's always going to create a delay for that garment. And we know that your patient matters, and you don't want there to be a delay. Stay in touch with us. When you have complicated cases, we will offer extensive help so it results in a first-time fit. Reach out to your medical advisors or your JoViPak inside sales team, which is Kathleen Lutman or Anastasia Stebakova. Good luck, everyone. This is the end of this presentation. I will, however, want to talk to you about our medical advisory team, which follows. The Lymphology Medical Advisor team is all over the United States. This territory map is the regions of where our medical advisors reside. See the following list for the medical advisor list themselves. These people are educated and creative individuals who have great experience and expertise. So don't hesitate to contact your appropriate advisor at any time. For those of you who are in the white areas, quote unquote white areas, they are managed by our JOBST JoViPak's inside sales team. And as I said, this would be Kathleen Lutman, who manages the western aspect of the United States, which is basically west of the Mississippi River, and the eastern half of the United States is managed by Anastasia Stebakova. And here are the names of all of those people who are representing certain areas of the U.S. Don't hesitate to print this out and to use it to contact your medical education advisors to give you the optimal customer service. Thank you, everyone.